Knock, knock. I'm washing my hands with hand sanitizer. My name is Megan. I'm a family nurse practitioner student with United States University. May I have your initials, please?
LB,
When's your birthday?
January 23rd, 1987.
And what can I call you?
Lee.
Okay, Lee. So this is going to be a respiratory examination of your chest and your thorax and your lungs. Do I have your permission to record this and upload it as unlisted to YouTube for my instructors and classmates to view?
Yes.
All right, I'm going to do a quick room scan. Error. These are just my instruments that I use for all my assessments, for most of them. Okay. All right, so we'll start out by inspecting. Um, we inspect, we palpate, we percuss, and we auscultate. So for purposes of this exam, I have his shirt on, but if we were in the clinic, I'd have his shirt off so that I could visualize his chest, his color, chest or eyes, and I could get a better skin-on-skin auscultation and feeling for percussion. But for modesty, for YouTube in the class, we're keeping the shirt on. The first thing I would do is inspect his chest wall. I am looking for any deformities. I'm looking at his sternum, the placement. I want to see if he's got pectus excavatum or pectus carinatum, which would be an inward or an outward barreling of the chest. I want to see his symmetry when he takes a deep breath, his chest rise and fall. One side should be raising higher than the other side. I want to see if he is using any accessory muscles, any respiratory distress, his posture, his position, if he is retracting, and he's obviously not in any respiratory distress, sitting comfortably, not in the tripod position or anything. And then I'm assessing his color. His lip color, I don't want his lips to be blue, I want them to be pink. I want his overall color to be pink, not blue, dusky, cyanotic, gray, nothing like that. And I'm gonna assess all of his capillary refill in all 10 fingers, should be less than 3 seconds. I'm also looking at clubbing, or looking for clubbing. There shouldn't be any, that could be a sign of COPD. So his capillary refill in all 10 fingers is less than 3. Next thing that I do is I palpate. So I'm going to first feel for tactile fremitus. I'm going to take my hand and put it on certain spots of his front of his chest. Make sure I hit all the lobes, his lateral lungs on both sides, and then the back of his chest in all the lobes. I want him to say 99 when I put my fingers there, and it's just helping me feel that there is equal vibration on both sides and all lobes of his lungs. So we'll do that first. So say 99.
99.
Again?
99.
Again?
99.
Again?
99.
All right, let's do under your left lateral here. Left lateral lung. Okay.
99.
Okay.
99.
Okay.
99.
All right. And then under your right arm here, so the right lateral lobes.
99. 99. 99.
Okay. And then can you face that way, please? On his back, we'll do the same thing.
99. 99. 99. 99.
Okay. So that all feels normal. The vibrations are equal bilaterally and they're symmetrical. Next thing I'll do is palpate for costochondral tenderness. So I'm palpating in between his rib spaces and the intercostal spaces. For any tenderness, there shouldn't be any tenderness. Also palpating to see if there's any crepitus, which would be a sign of an air leak, which is abnormal. So just palpating. Do you feel any tenderness?
No.
Make sure you get in between the ribs for all 12 of them. And you just do that on the front. Next thing I will do is observe respiratory excursion. So I'm going to put my hands like this in the middle of his chest, where my thumbs are at the level of his 10th rib, and with a little bit of skin in between. When he breathes and takes a deep breath, I should see my hands going out and then back in as he exhales. They should symmetrically move. They should move, first of all, showing that his diaphragm is moving out. And then they should come back. They should be symmetrical. They should come back with his chest rise and fall. So let's do that. So thumbs at the level of the 10th rib. And inhale. Exhale. All right, and then I'm going to do that on the back too. Inhale and exhale. Okay. So equal symmetrical movement with my hands. Next thing that I'm going to do is percuss. So I'm going to percuss in all lung fields from the top to the bottom, in the front, the back, and on the sides. Keeping in mind the right lung has 3 lobes, the left lung has 2 lobes. And then after that, I will auscultate the same spots that I percuss. But I want to percuss in his intercostal spaces, because if I do it on the ribs, I'll feel dullness and hear dullness. In the intercostal spaces, I want to hear resonance, and that's going to be normal. So you just hang out. I'm just going to percuss using striking with my dominant middle finger on the right hand onto the distal flange of my non-dominant middle finger. And I'm hearing resonance on the right side and the left side. Okay, so anteriorly, all lobes are resonant. Can you lift up this right arm? I'm going to do his right lateral percussion. Okay, and it's resonant in all lobes on the right lateral. On the left lateral. Okay, it's resonant in all lobes there. And kind of maybe turn that way. This is left side, right side. Make sure not to go over the scapula because it'll sound dull. Okay, so he is resonant in all lobes, front and back and laterally, bilaterally. Next thing I'm going to do is percuss for diaphragmatic excursion. So you do this on his back, percussing for the border between his lungs, which will be resonant, down to his diaphragm. When I feel the diaphragm, it'll be flat or dull. And I'm going to mark that spot. I'm going to do that while he's inhaling, and then I'll have him exhale and hold his breath. I'll do it again. That spot should be a little higher than the lower spot, because when you inhale, your diaphragm moves down. When you exhale, your diaphragm moves up. I do that on both sides. I should find that the markings are equal, same level, bilaterally. So you can face that way again. I'll start on the right side, and I'm just going to have him inhale and hold it. Inhale and hold it, please. Percussing, feeling resonance until I get to the diaphragm right here. So you can exhale If I had a skin marker and he didn't have a shirt on, I would mark it right here. And then I'm going to do the same thing as the right side. I'm going to do it on the left side, remembering where this marking was. All right, so inhale again and hold it. Resonant, resonant, resonant. Dull right here. So it's equal. You can breathe on both sides. And then I'm going to have him, I'm going to do it on the right side again. And so take a deep breath and then exhale and hold it. Okay. Okay, and it gets dull. You can breathe a little higher than it did when he was inhaling. This distance is about 3.5 centimeters. Normal is between 3 and 6. Do it on this side just to make sure it's even. So inhale, then exhale and hold it. And this is where it gets flat. Dull. Breathe. So these two are even. These two are even. Both are about 3.5 centimeters in distance. So that shows me that his lungs are expanding and that they're expanding symmetrically. Last thing that I'll do is auscultate all the areas that I percussed previously. And I'm listening for just making sure his breath sounds are clear. I don't want to hear any adventitious sounds. Don't want to hear wheezing, crackles, fine crackles, coarse crackles, bronchi, anything like that. And I do want to hear breath sounds. Sometimes you don't hear them, and that's not good. So I'm listening with the diaphragm. Take a deep breath, please. Again. Okay. And then I'm going to listen left lateral. Again. All right. And then we'll listen in the right lateral lobes. Okay. And then kind of face that way, please. Okay, so all his breath sounds are present, clear, equal bilaterally in all lobes. Last thing I'm going to do is a test to test for bronchophony. So just how I had him say 99 when I was doing tactile fremitus, I'm going to have him say 99 as I auscultate, and it should sound muffled in my stethoscope, should not sound clear. If I hear him clearly saying, if I hear his voice clearly when I'm auscultating, and I hear 99, it sounds clear and crisp, that could be a sign of consolidation, like if there's pneumonia. So in all lobes, I'm going to listen again, and it should be muffled. So in every spot is the last thing. In every spot, say 99.
99, 99, 99, 99,
And it's definitely muffled.
99, 99, 99, 99, 99, 99.
And then lift your arm, please. Okay.
99, 99, 99, 99,
Okay. Go ahead.
99, 99, 99, 99,
All right, and then face that way. Go ahead.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
And so he is negative for bronchophony, which means that Every time I listened, it sounded like what I was hearing was instead of 99. So that's it. That concludes my video. Thank you very much.